In a slight relief when India is witnessing a dip in daily fresh cases after reporting more than 4 lakh cases in a day during the ongoing deadly second wave of COVID-19, WHO chief said India remains hugely concerning, with several states continuing to see a worrying number of cases, hospitalizations and deaths. During a briefing, WHO chief Dr. Tedros said WHO is responding and has shipped thousands of oxygen concentrators and other medical supplies, and we thank all the stakeholders who are supporting India.
India remains hugely concerning, with several states continuing to see a worrying number of cases, hospitalizations and deaths. WHO is responding and has shipped thousands of oxygen concentrators, tents for mobile field hospitals, masks, and other medical supplies. And we thank all the stakeholders who are supporting India. But it's not only India that has emergency needs. Nepal, Sri Lanka, Vietnam, Cambodia, Thailand, and Egypt are just some of the countries that are dealing with spikes in cases and hospitalizations.
Signaling a warning, WHO chief also cautioned that the second year of this pandemic will be far more deadly than the first.
COVID-19 has already cost more than 3.3 million lives, and we're on track for the second year of this pandemic to be far more deadly than the first. Saving lives and livelihoods with a combination of public health measures and vaccination, not one or the other, is the only way out of the pandemic.
WHO chief also urged wealthy countries to reconsider their plans to vaccinate children and instead donate COVID-19 shots to the poorer nations.
In a handful of rich countries, which bought up the majority of the vaccine supply, lower risk groups are now being vaccinated. I understand why some countries want to vaccinate their children and adolescents, but right now I urge them to reconsider and to instead donate vaccines to COVAX. Because in low and lower middle income countries, vaccine supply has not been enough to even immunize health and care workers, and hospitals are being inundated with people that need life-saving care urgently. At present, only 0.3% of vaccine supply is going to low-income countries.
Talking about the other affected countries, WHO chief said it is not only India that has emergency needs, but Nepal, Sri Lanka, Vietnam, Cambodia, Thailand and Egypt are just some of the countries that are dealing with spikes in cases and hospitalizations. INS report.